You know, when you see a positive pregnancy test in the movies, it is, it's always this moment of just instant, uncomplicated joy.
Oh, totally. The music swells, they hug, and boom.
Right. They're having a baby. The narrative just immediately jumps to, like, painting the nursery and picking out names.
Yeah, the cultural expectation is definitely that biology is just this straight line from that little plus sign all the way to the delivery room.
But then, you step into the real world of reproductive medicine, and that cinematic illusion shatters pretty quickly.
It really does.
We are looking at a clinical landscape today that is often quietly heartbreaking, because the reality is that 10 to 20% of all known pregnancies end in loss.
Which is a staggering number.
It is, and yet it's something people still whisper about, as if it's this rare anomaly.
It is the absolute definition of a silent epidemic. I mean, it is so common, yet deeply isolating for the people going through it. And mostly, that's because we just don't talk about the biology of what is actually happening during those crucial early days.
Exactly. Which is why we are dedicating today's deep dive to really pulling back the curtain on this deeply sensitive window of human biology.
Right.
And we've got an incredible foundation of research to guide us for you today. We are looking at clinical data from the March of Dimes and the Cleveland Clinic, plus this fascinating 2021 review on the role of hypoxia.
Which is low oxygen.
Right, low oxygen in early pregnancy.
Right.
And we also have some landmark peer-reviewed medical studies from 1996 and 2016 exploring acupuncture.
The clinical side of it,
Yeah. And to ground all this science in the real world, we are looking at the specific clinical protocol of the Berkeley Center for Reproductive Wellness out in New York City.
Because our mission today isn't just to talk about the tragedy of loss.
No, definitely not.
Our goal is to explore the surprising, almost counterintuitive biological mechanics of early pregnancy, specifically how oxygen supply works in those first few weeks. And then we really want to understand the evidence-based science behind how an ancient non-drug practice like acupuncture is actively being used to support patients through this incredibly vulnerable time.
Okay, let's unpack this.
Yeah.
Because to understand the solution, we really have to understand the sheer biological tightrope walk of the problem here.
Absolutely.
We need to talk about the timeline. The data from both the March of Dimes and the Cleveland Clinic points to a very specific, very dangerous window.
The first trimester.
Yes, 80 to 90% of miscarriages happen in the first trimester. We are talking about before the 12 or 13-week mark.
That is the critical threshold. Once a pregnancy crosses that 13-week line, the statistical risk of loss just drops off a cliff.
It's a huge drop.
Yeah. Less than 5% of miscarriages occur after 20 weeks. So the question we have to ask biologically is, well, what exactly is happening in those first 12 weeks that makes the whole system so incredibly fragile?
And according to the Zhao 2021 study in our stack, the answer comes down to something we usually associate with, like life and vitality.
Oxygen.
Yes, oxygen. The study introduces this concept called the oxygen paradox. And I have to admit, reading this totally broke my brain at first.
It's so backwards from what we learn.
Right, because we are conditioned to think that oxygen is universally good. Deep breaths, oxygenated blood, it's all positive. But in the very early weeks of pregnancy, a high oxygen environment is actually toxic to the developing embryo.
It is entirely counterintuitive. You would assume the first thing a growing life needs is a massive influx of oxygen.
Obviously, right.
Right, but the Zhao review explains that in those earliest weeks, the environment around the embryo is naturally and necessarily low in oxygen.
It's a state of hypoxia.
Exactly. And that low oxygen state is actually what guides the proper development of the placenta.
Wow.
The early embryo simply does not have the cellular defenses to handle the oxidative stress that comes with a rush of oxygen. It would literally damage the early cell structures.
The best way I could picture it while reading the research is to think of the early embryo like a tiny seed you've just planted in the soil.
Okay, I like that.
Down there in the dirt, it's dark, there isn't much air. But that seed needs that dark, low-oxygen environment to carefully establish a very delicate root system.
Right, it needs time.
Yeah, and if you were to somehow blast that tiny, fragile seed with the full, blinding heat of the sun right away, you'd fry it.
You'd kill it instantly.
Exactly. It needs to build its roots in the dark before it can handle the full force of the sun, which, in this medical case, is a heavy, fully oxygenated maternal blood supply.
What's fascinating here is how perfectly that analogy captures the mechanical reality of placentation.
Oh, really?
Yeah. Those roots you're talking about are a network of maternal blood vessels called spiral arteries.
Okay, spiral arteries.
And during this first few weeks, those spiral arteries have to physically remodel themselves.
What does that mean, physically remodel?
They essentially have to untwist and widen their structure to connect properly to the developing placenta.
Oh, wow, so they literally change shape.
They do. And while they are doing that intense construction work, the oxygen flow has to remain relatively low and tightly controlled.
But that construction site is exactly where the failure point happens, isn't it?
Yes. And the reason that's so dangerous is that the biological mechanical balance is completely lost if those spiral arteries fail to remodel properly.
Right.
If the construction goes wrong, or if, say, maternal stress hormones, systemic inflammation, or pre-existing vascular issues cause those blood vessels to constrict and tighten up.
The whole system gets choked.
Exactly. The embryo suddenly experiences a shortfall of oxygen relative to what the rapidly growing tissue actually needs at that exact moment.
So the root system gets choked out by tight blood vessels.
Precisely. And the research links this specific type of vascular dysregulation.
The failure to manage the blood and oxygen flow.
Right. It links that to significantly higher risks of pregnancy loss and later complications like poor fetal growth.
Which brings us to the ultimate medical catch-22.
Yeah, it's a tough one.
If the root cause of this danger is primarily mechanical, we are talking about constricted blood vessels, poor local circulation, and stress hormones literally tightening the pipes, how on earth can a patient safely intervene?
You can't just throw medication at it.
No, because you can't exactly prescribe a heavy pharmaceutical vasodilator to someone whose embryo is so delicate.
And just to clarify for everyone, a vasodilator is a medication designed to forcefully widen blood vessels to increase blood flow.
Right. You wouldn't want to use a heavy drug to force the blood vessels open, because even a little extra rush of oxygen could harm that fragile embryo.
It would be like blasting that seed with the sun.
Exactly. The environment is just too delicate for conventional chemical interventions.
That is exactly the dilemma reproductive endocrinologists face. You have a purely physiological problem.
The blood flow resistance.
Right. In an environment where chemical interventions are highly restricted due to the vulnerability of the fetus?
So if the lab data shows us that the problem is physical tension and restricted blood flow, but we can't use heavy drugs, how do we actually fix this?
Well, this is where it gets really interesting.
Yeah, this is where the acupuncture research completely changes the conversation. And if you're listening to this and feeling a little skeptical, I get it.
It sounds a bit out there at first.
I had a moment of hesitation too. We tend to think of acupuncture in this very abstract wellness culture sort of way.
Like a spa treatment.
Yeah, exactly. But the clinical studies completely pull it out of the abstract and place it firmly into measurable physiological science.
We're moving from theory to hard data here.
Yes.
The studies demystify the practice entirely. In a clinical setting, it's not about invisible energy fields. It's about needles, nerves, and blood flow.
Let's look at the 1996 Standard Victorian study. I was just amazed by the methodology here.
It's a great study.
These researchers didn't just ask patients how they felt on a scale of 1 to 10. They used Doppler ultrasounds.
Which is hard imaging.
Right. They physically bounced sound waves off the red blood cells to measure the speed and resistance of the blood flow in the uterine arteries of women dealing with infertility.
And what did they find?
They administered a specific course of electroacupuncture, and the ultrasound proved that the treatment significantly reduced blood flow impedance.
Impedance being the critical metric there. It basically just means resistance.
The way I think about impedance is like a massive highway system. Usually, traffic flows smoothly.
Okay.
But suddenly, there's major construction. The lanes get squeezed down from 4 lanes to 1. That construction creates massive resistance. That's impedance.
That's a really good visual.
The cars, which in this case are the oxygen and nutrients, they want to flow, but they are backed up precisely when the destination needs them the most.
Right.
And the Standard Victorian study demonstrated that electroacupuncture effectively clears the construction and opens the lanes back up. By lowering the resistance in those specific uterine arteries, blood can move much more easily into the uterus.
And the mechanism behind clearing those lanes isn't magic. It is the autonomic nervous system.
The part of the brain we don't control.
Exactly. The autonomic nervous system controls all our involuntary functions, like heart rate and digestion. When a patient is highly stressed, which is incredibly common in early pregnancy, especially for someone with a history of loss.
Oh, absolutely. The anxiety is huge.
Right. Their body enters a fight or flight state. That triggers a massive spike in stress hormones, specifically cortisol.
And cortisol is essentially the construction crew squeezing the highway down to one lane, right?
That's a great way to put it. Cortisol is a powerful constrictor.
Wow.
Evolutionarily, if you are running from a predator, your body restricts blood flow to non-essential organs, like the reproductive system, and pushes it to your muscles.
So you can run away.
Yes. So when a pregnant patient experiences high stress, their blood vessels tighten. It can even increase the muscular activity of the uterus itself, causing cramping.
Which is terrifying.
It is. Acupuncture works by communicating with the central nervous system to trigger a parasympathetic shift.
The rest and digest state.
Exactly. By systematically promoting relaxation and down-regulating that cortisol spike, it helps keep those blood vessels open and the uterine muscle quiet.
Okay, but I have to push back here a little bit.
Sure.
Wait a minute. You're telling me that sticking tiny superficial needles into someone's arm or leg can physically stop the active cramping and bleeding of a threatened miscarriage?
I know how it sounds.
Because that sounds almost entirely unbelievable to me. A threatened miscarriage is a violent biological event deep inside the body. How can a tiny needle on the surface of the skin stop what is happening deep inside the uterus?
If we connect this to the bigger picture, we have to look at the hard wiring of the human body.
Okay.
The surface of the skin is packed with highly sensitive nerve endings. When you stimulate those specific points, they send rapid signals directly up the spinal cord to the brain. The brain then processes that signal and sends a command back down through the autonomic nervous system to the organs. You are basically using the skin as a keyboard to type a command directly to the brain, telling it to relax the smooth muscle tissue in the uterus.
That is wild.
And to answer your skepticism directly, we have to look at the 2016 feasibility randomized trial led by Deborah Betts.
I was looking at that Betts study, and what shocked me was that these weren't just women trying to get pregnant.
No, they were in the middle of a crisis.
These were 40 women who were actively bleeding and cramping. They were in the middle of a threatened miscarriage with viable pregnancies.
Right.
It's an utterly terrifying medical state.
It is arguably one of the most frightening experiences a patient can endure.
Yeah.
The researchers took these 40 women and divided them into two groups. One group received acupuncture, and the control group received a light touch intervention to act as a placebo.
And the data wasn't just a fluke.
Right.
There was a mathematically significant drop in their symptoms.
Yes, P equals 0.04, which is statistically significant.
The women who received the acupuncture reported a massive reduction in the bleeding, the cramping, and the back pain compared to the placebo group.
Yes. And while the authors are very clear that a trial of 40 women is simply too small to definitively prove differences in overall long-term live birth rates.
Right. You need thousands of people for that.
Exactly. But what it did prove is vital for clinical care. It proved that acupuncture is a physically safe, highly acceptable tool that alters local circulation and provides massive symptom relief.
It quieted the storm.
Exactly.
It gave the body a chance to regulate itself when it was caught in this destructive feedback loop of stress, cortisol, and vascular constriction.
Precisely.
Okay, so the lab data shows needles reduce stress and open blood vessels. But how do you actually apply that to a terrified patient in week 6 of a pregnancy?
You need a system.
Right, who is actually taking this data out of the medical journals and putting it into practice.
You have to operationalize the science into a tangible clinical protocol. And that is where Mike Berkeley and the Berkeley Center for Reproductive Wellness come in.
Right, in New York.
Yeah, he founded the center in Midtown Manhattan back in 1998, and it was actually the first complementary medicine center in the United States dedicated exclusively to fertility challenges.
And his entry into this field wasn't purely academic either.
No, it was very personal.
It was born out of a very frustrating medical journey. He and his wife were facing severe infertility issues on both sides.
Yeah, they were dealing with female factor challenges alongside male factor infertility.
Specifically, they were dealing with issues regarding sperm morphology, which is the physical shape of the sperm, and motility, which is how well they can swim.
When you are dealing with compound infertility like that, the emotional toll is devastating.
Oh, I can't even imagine.
They went through the conventional medical system, tried the standard treatments, and they failed. They were basically at the end of their rope.
But then they pivoted. They tried acupuncture and carefully chosen herbal medicine.
And it worked.
Yeah. Within a few months, that intervention led to a healthy pregnancy. It completely changed the trajectory of his life.
He literally changed careers.
He was so impacted by this outcome that he walked away from his previous career. He underwent rigorous training, became a licensed acupuncturist and a board-certified herbalist, and spent the next 27-plus years building a practice centered entirely on integrative reproductive care.
And if you look at the exact methodology of the clinic today, it is a masterclass in integration.
How so?
They don't operate in a silo, and they certainly don't reject Western medicine.
Oh, right.
They combine acupuncture, customized herbal formulas, and low-level light therapy, but they do it in close, active collaboration with mainstream reproductive endocrinologists.
That's amazing.
The focus is entirely on measurable biological goals: improving the endometrial lining, supporting IVF cycles, and ensuring stable early pregnancy through better blood flow.
I want to zero in on their specific protocol for patients who actually achieve pregnancy, though, because the clinical guidelines they use are incredibly specific.
Very specific.
If a patient gets pregnant, the Berkeley protocol mandates acupuncture twice a week, every week, for exactly 13 weeks.
It is a very intensive schedule requiring a lot of commitment from the patient.
Here's where it gets really interesting, because as I was reading that, the math suddenly clicked in my head.
Yep.
That 13-week protocol perfectly, exactly mirrors the statistical danger zone we talked about at the very beginning of this deep dive.
It's not a coincidence.
The March of Dimes and the Cleveland Clinic explicitly state that 80 to 90% of all pregnancy losses happen before week 12 or 13. Berkeley didn't just pick a random number of weeks to treat his patients.
Not at all. The frequency and the duration are highly intentional and heavily evidence-informed.
Right.
The logic is brilliantly simple when you look at the biology. You provide the most intensive support, you actively work to lower systemic stress, and you mechanically keep the blood flowing freely via the nervous system during the exact window when the biology of the pregnancy is at its absolute most vulnerable.
You are basically building a scaffolding around that tiny seed while it establishes its root system in the dark.
I love that analogy.
And you keep that scaffolding up, maintaining the low stress and the open blood vessels until you are absolutely sure the roots are strong enough to handle the sun.
Exactly.
And once you hit the end of week 13, the scaffolding comes down because the statistical risk of loss plummets. The placenta is formed. The spiral arteries are successfully remodeled. And the odds of continuing to a healthy live birth are finally strongly in the patient's favor.
It is an elegant application of science. You monitor the patient twice a week, you adjust the care based on how their nervous system is responding, and you systematically counteract the cortisol spikes and vascular constriction that we know threaten the delicate oxygen supply.
You're guiding them through.
Right, you carry them through the danger zone using their body's own neural pathways.
So what does this all mean? When we look at this entire journey, from the tragic statistics of the first trimester to the microscopic remodeling of blood vessels to the clinical application of an ancient practice.
It's a lot to take in.
It is. But I think the big takeaway is that this deep dive isn't just about early pregnancy. It is a profound, beautifully documented example of how integrative, non-drug interventions can be systematically applied to relieve stress and physically, measurably alter blood flow.
Without a doubt.
It shows us that we have tools to support human beings through their most terrifying and delicate medical windows without always needing to resort to heavy pharmacology.
It bridges the gap between ancient technique and modern physiological measurement. And honestly, looking at the Doppler ultrasounds, proving the change in arterial resistance without the use of drugs.
Yeah.
Well, this raises an important question.
What about that?
We've just learned that tiny sterile needles placed lightly on the surface of the skin can demonstrably lower blood flow impedance in something as deeply internal and heavily guarded as the uterine arteries during early pregnancy.
Right.
It actively changes the mechanical reality of the organ by speaking to the brain. If a surface-level intervention can so profoundly alter the vascular resistance and stress hormones of our deepest internal organs during such a critical biological threshold,
Oh, I see where you're going with this.
what other major, deeply internal physiological transitions in the human body are we currently missing the opportunity to stabilize using these exact same subtle mechanics?